Welcome to the Voices of Otolaryngology podcast series, where we spotlight diverse perspectives and insights within the field of otolaryngology. I'm your host, Rahul Shah. Let's jump into it. Welcome to Voices of Otolaryngology. I'm here at the Oto Forum. It's April with Karen Rizzo. Hi, Karen.
Hi, nice to see you.
Well, thank you, Dr. Rizzo, so much for everything you've done for the Academy, first and foremost.
I'm thrilled to be part of this Academy. It's really doing wonderful work for our specialty.
Well, it's people like you that do that wonderful work. We could have talked about a lot of things this morning, but many members, and you'll blush when I tell you this, admire the work you do with engagement and advocacy. And you said it yourself coming in here. Are we talking about national? Are we talking about state? And I said, let's talk about state engagement. And then you said, are we talking about specialty or medical society? Talk a little bit. How did you get engaged? It is so intimidating to get engaged at a state level. I'm just an otolaryngologist.
Well, it all started really in my residency. I trained at Thomas Jefferson University Hospital in Philadelphia, and Dr. Dale Lowry was our chair at the time. And he was also very engaged in the politics of our specialty and in advocacy in particular. When I finished training there, I moved out to Lancaster, Pennsylvania, which is about a half hour from Harrisburg, which is the state capital. And it's there that the Pennsylvania Medical Society is headquartered. So Dr. Lowry had asked me to represent our specialty at the state level with the State Medical Society. And that basically entailed maybe going to 4 meetings a year representing otolaryngology and our issues at something called the State Board of Medicine. And it had representation from all specialties in the House of Medicine, and I was there representing our specialty. So through that, I began to learn about issues that affect how medicine is treated at the state and national level, and how politics and educating legislators is so important to determining rules and also scope of practice. So from that engagement, I grew to become the chair of that department, and then I ran for president of the State Medical Society. I was the first otolaryngologist to win that election in the state of Pennsylvania.
What year was that?
2015, and I was also the 5th woman to be president. The Pennsylvania Medical Society is the first and oldest medical society in the country.
Wow.
And it was started in Lancaster, 1800 and something.
Oh,
I forget the actual date. But so I was very
200-year-old society with only 5 women leaders.
Yeah.
And you're one of them.
Right. But that's growing too, as more and more women get more engaged and involved in advocacy and leadership and have those opportunities.
So what's intimidating is, how did you know back in the early days, or even when you're representing the state for otolaryngology, how do you know what the issues are?
Well, it's important to get engaged and to read and to understand information that's being sent by our state specialty society as well as our national, the American Academy of Otolaryngology. And I think there's an opportunity there for people to learn a lot about advocacy through those 2 venues. But you have to be willing to learn as well, and we have to make that communication process easy for people to understand it and to really highlight and target the important issues. Because we have a job to educate the legislators, because in so many circumstances, they are the ones who really impact the way we practice. Between their interaction and insurance companies, it really dictates now more than ever what we do and how we do it, and then obviously how we get paid to do it as well. And all that influences the way patients can access care, as well as determine the financial viability of practices, whether it's private practice, hospital employed, or large academic centers.
One thing I hear from members that are trying to get involved at the state level with advocacy is they never want to hurt other practitioners. They don't want to hurt the specialty. So do you think about that when you're advocating on the state societies?
Well, you want to make sure you understand the issues and from different perspectives. I think for Pennsylvania in particular, our Pennsylvania Academy of Otolaryngology is unique because we have several training centers in our state. So I think the academic perspective is adequately represented, And then private practice, because it's shrinking not only in our state but throughout the country, that seems to be the venue that is getting harder and harder to have their voice heard. So, but as a state society, you want to try to, encourage all aspects of otolaryngology to be represented. And that's really where the challenge is to get very, busy docs to want to learn about advocacy, understand the importance of it, and be willing to talk to legislators about it.
And so how do you do that? How do you get folks involved?
Well, what I've done in several circumstances, at least in Lancaster, where I practice, is, I'll hold events for legislators in my home, or we'll have it at a local restaurant where we'll talk to them about issues specific to medicine as well as our specialty. And you develop relationships with your home legislators. That's where it starts, both at the state and national level. I mean, I've gone to Washington on several occasions and sat with congressmen from our area to talk about issues that impact my specialty as well as the House of Medicine in general.
Does it make a difference?
It does. They want to hear from us. And when we
From
have...
you're their constituent.
Right. And when you have something that's specialty specific that they usually don't know a lot about, they welcome that knowledge. They welcome the fact that you come and talk to them about educating them about this issue so they understand it from all viewpoints.
Lance Manning is our coordinator of advocacy, and in Arkansas, he helped speak directly to his legislature. And so you see that in Pennsylvania as well, right? You can go to Harrisburg.
Absolutely. And, I'm a half hour from Harrisburg, so it makes it easy from a travel perspective to get there.
What is one of your most memorable moments on a state level, whether it's otolaryngology or state medical society, where our voices were heard? They don't have to vote for us, but they heard us.
Well, a lot of it has to do with scope of practice. And in one particular issue, this was probably about 10 years ago when I was the president of the State Medical Society. I had been president of the Otolaryngology Society as well. There was an issue about audiology and scope of practice, and I went and testified, at the state capitol regarding our concerns about expanding their scope of practice.
As their training.
Right, past their training, the way they were advertising and marketing themselves in the newspaper, how we thought that, they were deceiving the public. And that was very well received, and it made a difference. It stopped some of the practices that were going on.
That's amazing. And you spoke one-on-one with legislatures, you attended committee hearings.
It was a hearing. It was an actual hearing.
So how did you know your speaking points? That's what intimidates us.
Well, I rely on our national organization, the American Academy of Otolaryngology, and the way it shares information with state societies. And I think in Pennsylvania, we're organized, and we do reach out to the Academy for that information. We go through, when it's a billing issue or a regulatory issue, we go through the departments that are here and your wonderful staff to help educate us and give us background information so we can make a cogent and, meaningful discussion with the legislators.
Is it fair to say you're not alone?
Absolutely. Yeah, there's a team. I'm not the only one doing this, although sometimes I feel like I am. But it's all about trying to communicate more effectively.
So what advice would you give? I am an otolaryngologist in a state. Let's not use my home state of Maryland. Pick something else. And I feel threatened, the practice, the business of medicine, scope of practice, reimbursement. What should I do? How do I get involved?
Well, I think the first thing you do is, look and see, are you a member of your state society?
Okay.
If you're not, you should be.
And very easy and affordable, usually.
Absolutely. And then, are you a member of the American Academy of Otolaryngology? Obviously, that goes without saying because that's incredibly important.
Okay, so let's make sure your memberships are up to date.
Right. And also look at the state medical society where you live, because sometimes, depending on the state that you're in, there may not be an organized state specialty society, but your state medical society can fill that void. So it behooves you to kind of reach out and ask your peers about it too, if you don't know yourself where to go. But it varies state by state. That's the problem. I mean, I'm fortunate to be in Pennsylvania because we are very organized, and our Pennsylvania Academy of Otolaryngology has been in existence since like the mid-1960s when they split from the ophthalmology group. And they've always been very engaged. But I think a lot of that has to do with all the training programs that we have. So the residency program directors try to promote involvement and engagement of the residents at an early level, and even with the medical students.
So you're fortunate in Pennsylvania. I would posit that if you're in a state that's disorganized or not as coordinated, that's another opportunity. Not only an opportunity to lead, but to affect change.
Right, and again, it may be more challenging,
Sure,
based on the ability to kind of coordinate that effort. But that's where, if you don't have something local or state, you have to reach out to the American Academy of Otolaryngology, because that's what this organization is here for, is to help everyone in the entire country, regardless of what your state situation is.
I'm very algorithmic, so I'm going to keep pushing this algorithm. So first, let's make sure I'm a member of my state specialty or state medical society. Of course, member of the American Academy of Otolaryngology Head and Neck Surgery. Then start reaching out to my state society, and I reach out to the officers, or they're talk to me a little bit about where do I go from there?
Well, again, it depends on the organization of the society. We in Pennsylvania do have a president and a vice president and an executive council, and also an administrator. We have a lobbyist. So we have several people on the team.
And they'll take my calls?
Absolutely. They'll take your call, they'll take your email, your text. Absolutely. And the other thing I want to point out, too, is your community. Because county medical societies have a place in all this too. And for some people, that's how they get involved, early on. They move to a new area, they join a new practice, they don't really know anyone. The county medical society can be a point of entrance into organized medicine, and at least trying to branch out and connect with people who are interested in the community, that where you're practicing, and then where you go from there. Because usually the county medical societies have a good connection with the state medical society. They're part of it. They're under that umbrella. And that can help you branch out and learn and get more information.
What a wonderful nugget. I'm in Maryland, and I think of some of our leaders in the academy and OPPS, Dr. Annette Pham. Got very active with the county, then the state, Doug Ray, Mark Dubin. So that works.
Right.
And what's been awesome, Dr. Rizzo, is how welcoming these county and state societies are. We shouldn't be intimidated. They want to hear from us. They educate us. They welcome us with open arms. Am I right about that? They're amazing.
Absolutely. And you'll also find, too, depending on how the county medical society works, sometimes they communicate very well with their public through local TV stations. We do something called Docs on Call once a year through our local TV station in Lancaster. I can tell you, over the course of 2 to 3 hours, we probably get over 700 calls.
From Lancaster.
Right,
Here.
in that central Pennsylvania area. Once that phone starts ringing, you're answering it, you're talking to the patient, giving them advice, and then you hang up, and once again it starts. And it's nonstop. Usually we go for about an hour to 15-minute
That is so
shift.
cool. And tell me about that. What do you think is the advocacy, legislative goodwill benefit of that?
Well, you're helping patients, at least direct them with the kind of care that they're looking for, and they're so appreciative. And sometimes it's people looking for second opinions. They don't know where to go. Access to care, as you know, is becoming a bigger and bigger issue for numerous reasons. And sometimes just saying to them, listen, you're not going to be able to find what you need locally. It's time to go to Philadelphia, or it's time to go to Pittsburgh, or to go, outside of our region to get the help you need. We're not far from Hopkins as well. So in my particular area, thankfully, we have lots of resources to refer people to if they can't get what they need locally.
There's a criticism that it could take decades to get engaged in the political process. I'm struck by the fact that 2015, you were a leader in your state, and it can happen quickly, where if you are passionate about the work, they will embrace you. And your state societies want leaders.
Absolutely.
Of all kinds, diverse and inclusive.
Right. And I think it's so important for young physicians to understand that. They're at the beginning of a process. But what you get out of that process is really a reflection of what you're willing to put into it.
Yeah, yeah.
And the legislators want to be educated by us. They want to hear from us. That's so important to them because we're a trusted source of information and knowledge. And they are very open-minded to our comments and knowledge about specific issues.
Yeah. And the other intimidating point, and I'll wrap this up because I'm so appreciative of your time. Another intimidating point is I don't have the time for this. But like you said, it's not a big lift.
Yeah, it really isn't. And there's lots of people out there that want to help and bridge that communication gap for you. So I encourage everyone to really think about getting more engaged in legislative advocacy because it's an important role that we and only we can do to educate legislators about the importance of our issues and how their decisions impact the way we take care of patients.
That was perfectly said, Dr. Rizzo. Thank you so much for showing us that it's not intimidating and that we all can make a difference.
Thank you.
Thank you so much.
We hope today's episode sparked some fresh ideas. If it resonated with you, please subscribe and share it with friends. Have thoughts or suggestions? Use the feedback form in the show notes. We'd love to hear from you. And don't forget to follow us on social media for highlights, behind-the-scenes content, and updates. Thanks for listening. See you next time.